Good morning. I'm Professor Dr. Nuran Abaza, Professor of Rheumatology, Physical Medicine, and Rehabilitation. We are going to go through the examination of the wrist and hand joints. By the end of this session, the student will be able to locate the different anatomical landmarks around the wrist joint, perform physical examination for wrist joint and hand, including muscles, joints, and nerves, elicit the normal range of motion of the hand, wrist joints, and recognize the abnormal ones. Perform special tests for thumb tenosynovitis. This picture shows the surface anatomy of the hand. Figure A shows the dorsum of the left hand, while figure B shows the palm of the left hand. Number 1 shows the place of the extensor retinaculum, while number 2 shows the place of the flexor retinaculum. Number 3 is the position of the metacarpal bone heads, both on the dorsum and on the palm, whereas number 4 and number 5 hints for the ulnar nerve, an artery, and the radial artery. Number 6 and number 7 indicates the superficial palmar arch and the deep palmar arch. Let's start the examination of the hand and wrist joints. صباح الخير.
صباح النور.
اسم حضرتك؟
سيد سالم.
أهلا يا أستاذ سيد.
أهلا بيك.
ممكن نكشف على مفاصل الرزغ والصوابع عندك النهارده اليد؟
تحت أمرك.
شكرا جزيلا. Let's start by inspection of the wrist and hands, and we place the wrist and hands on a pillow to be comfortable for the patient. Then we will start to inspect for any swelling, sinuses, or scars for the skin integrity. We will check for the muscle, and we will check for any bone deformity or soft tissue swellings. Now on palpation, we should assess the temperature over the joint, the wrist joints, and the hand by comparing to the forearm. Also using the dorsum of your hand. Coming to the palpation of the wrist and hand joints, you should palpate the wrist using your thumb and index fingers of both hands. The thumb will go to the dorsum surface of the wrist, and the index will go to the flexor surface. You should palpate for tenderness while looking at the facial expression of the patient. You can also use the thumb and finger of one hand from mediolateral aspect. Then you should work your way up to the carpal bones and also look for any facial expression for pain. Then you should do a metacarpal squeeze, like that, to the metacarpophalangeal joints. You can check for the PIPs or proximal interphalangeal joints and distal interphalangeal joints using both hands this way. You should also palpate the anatomical snuff box for any muscle wasting, as well as the thenar muscle eminence and the hypothenar muscle eminence, and to palpate for any tendon thickening in the palm and in the wrist. Now you should look for the range of motion. We will look for palmar flexion, dorsiflexion, ulnar deviation, and radial deviation. سيد هننزل ايدنا لتحت. For palmar flexion, it brings to 75 degrees. ونرفع ايدنا لفوق. For dorsiflexion, it also brings for 75 degrees. You should fix the more proximal joint, like stabilizing the elbow. Then we will use radial deviation, which brings to a 20 degrees, and ulnar deviation, الناحية التانية, which brings to 35 degrees. You should also do all this range of motion against resistance to check for muscle weakness. ارفع ايدك يا سيد وقوم ايدي. تمام. لف ايدك. قوم ايدي لفوق. تمام. وللناحية دي. وللناحية دي. تمام. Now you should look for the range of motion of the metacarpophalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. The metacarpophalangeal joint have a range of 90 degrees, and the proximal interphalangeal joint has a range of 100 degrees, and then the distal interphalangeal joint has a range of 80 degrees. Now for the thumb, you should check for the range of motion of the metacarpophalangeal joint, which is a 55 degrees, and the interphalangeal joint here, which is an 80 degrees. بصي يا أستاذ سيد، هنرفع صباعنا لفوق كده. تمام. This is when you are checking for the abduction of the thumb. You can also do resistant movement for that one. زق على ايدي كده لتحت. تمام. تمام. طيب. ريح ايدك. You can also check for adduction. ضم صباعك على تمام. You can check for flexion and for extension. تمام. You can check for all these movement also with resistance like we did with the abduction. Now we have some special tests for the median nerve for the carpal tunnel syndrome. The first one is the Fallon test. It consists of flexion of both wrist joint against each other till you recreate a numbness or pain in the patient's hand. بصي يا أستاذ سيد، هنعمل ايدينا الاتنين كده. أيوة. And then you will wait for a 60 second or 1 whole minute. If it recreates pain or numbness, then it's a positive Fallon sign for carpal tunnel syndrome. شكرا يا سيد. Another test for the carpal tunnel syndrome is the Tinel sign, and it consists of recreating the pain or numbness and paresthesia by gentle percussion over the median nerve on the wrist. Now testing for the ulnar nerve, we will test for the adductor pollicis muscle. بصي يا سيد، هنخلي سيف يد مفتوح كده وهنحط الورقة بين صباعك وبقية اليد وتحاول تقفل عليها بصباعك ده كده بس وأنا هشدها. This is a negative test since there was no flexion with the interphalangeal joint, proving that the adductor muscle is working efficiently, which is supplied by the ulnar nerve, and that there is no need for the flexor pollicis longus to act, which is supplied by the median nerve. Now for the Froment test, if it is a positive test, then the adductor muscle is weak and it will need to do flexion as a compensatory mechanism by the flexor pollicis like this. Now for the Zicker-Van tenosynovitis, which is tenosynovitis of the flexor pollicis brevis and abductor pollicis longus muscle. You will ask the patient to flex the thumb, نقفل الصباع يا سيد ونقفل الصوابع التانية, and to flex the other fingers over it. And then you will perform an ulnar deviation. If this induces a pain along the track of the flexor pollicis brevis and adductor pollicis longus, then this is a positive sign for Zicker-Van tenosynovitis. Thank you.